What are your chances of dying from COVID if you catch it? That's what we're going to talk about today on A Taste of Medicine. Thanks for joining me. We're going to talk about a very important topic, and that is case fatality rate. When we're talking about infections, the case fatality rate is the number of people who die of the disease divided by the total number of people who become infected. And I've seen a lot of people with no health background talk about the discrepancy that they've been hearing about the case fatality rate. Well, why has it changed? Why wasn't it exactly the same thing in month 1 as it has been now in month 12? And in the summer, when it started to decrease, there were some who were calling out, well, this is because of the therapies that doctors are using to treat these patients and to reduce the number of deaths. And it is true that we do have a handful of medications that have been shown to reduce the number of deaths from COVID-19, but many of them aren't all that effective. And so I think it's a much more likely explanation that the reason that it seemed much higher early on in the pandemic was because we weren't testing people who weren't showing symptoms. Ask someone you know that works in healthcare who have been taking care of COVID patients since February, March, April. It was damn near impossible to be testing people other than those who were admitted to the hospital and were showing symptoms and who were quite ill. And the reason for that was there was a huge shortage of the reagents, the chemicals you need to run the test, and the machines to be able to run them tests in the first place. And as a result of us not being able to test everyone we wanted, we were only testing the sickest. And if you're only taking the most ill of any infection, of course, the outcomes are going to look significantly worse. Do not get me wrong. The mortality rate for this disease is still significantly high when we're talking about the massive numbers of people who are becoming infected. If someone says that this is just a bad flu, they are wrong, pure and simple. I was an intern in 2009 during H1N1. H1N1 killed 63 Minnesotans that winter. COVID-19 has killed over 6,000 in less than a year. So do not tell me this is a bad flu. Over 6,000 in less than a year to 63. This is not a bad flu. It is incredibly insulting and just a blatant lie to call it as such. Okay, tirade over. So what is the number? What are we dealing with? The problem with a lot of the studies I was seeing is they were very small numbers of patients who were enrolled. Or it was released very early on in the pandemic, April, May. And again, as our testing increased significantly, we became more aware that there were more asymptomatic or minimally symptomatic carriers out there. Now that we're coming up on a year out, we're in a much better place to retrospectively look back and say, what are the patterns that we're seeing? If you just take all comers and just look at the number of deaths compared to the number of infections as a whole, the case fatality rate in Minnesota throughout the pandemic is 1.34%, meaning that for every 100 people who have been diagnosed with COVID-19, 1.3 have died. In the United States as a whole, we're looking at 1.67% case fatality rate. And if you look at the Johns Hopkins global data, as of today, we're looking at a case fatality rate of 2.15%. So more than one person in 100 dies of this disease. That is incredibly significant. Folks, just over 7% of the United States population has been infected with COVID-19. We still have 93% who have not been infected, and ignore reinfection rates, which also can happen. 93% are still vulnerable. And we've had 400 and some thousand die. And if you're sitting watching this saying, well, 1% doesn't sound very bad. If everyone in the United States were to get infected, we're talking well over 3 million dead. A 1.3 or a 1.6 or a 2.1% case fatality rate is a lot. Okay, so that's the general population at large. But we keep hearing about risk factors of things that are going to make it either much more likely that you die from COVID-19. Here's a really interesting meta-analysis article that was published in September of 2020. We've talked about double-blind placebo-controlled trials as that's kind of like the Cadillac or gold standard of types of medical trials. A meta-analysis is where a couple authors look for similar trials and pool all of that data. So instead of just doing one trial, they might include 10 or 20 or 50. And the big plus there is even though all of those studies are going to be slightly different from each other and might measure slightly different things, by pooling a lot of these patients together, you can start to see really important trends. You have to recognize that all of these patients have already been hospitalized. So they are not the asymptomatic or minimally symptomatic people just walking around the community. And the money here in this article is really table 3. In table 3, you'll see the factors going down the left side of the table, and then something called the pooled risk ratio. The simplest way to think about a pooled risk ratio is, let's take obesity for example. They found that the pooled risk is 2.18. So what this table is saying is that if you were obese and you were admitted for COVID-19 pneumonia, that you were just over twice as likely to die from your infection than if you were not obese. So when we look at the risk factors that carry the highest pooled risk, those are going to be age, heart disease, and kidney disease, all with greater than a 3-fold risk of dying. Next up, high blood pressure or hypertension, stroke, COPD or chronic lung disease, cancer, liver, and obesity. All of those had more than a 2-fold increased risk of death. And finally, diabetes and being female had a slightly increased risk, about 1.5 times. So what I like about this study is that it's a meta-analysis, we're talking big numbers of patients, and it provides some useful ways of thinking about risk. A critique I have though is that it's not clear to me if they control for age. So what I worry about in these studies is that age is a confounding variable, being that, well, as you get older, you're more likely to get diabetes, you're more likely to get cancer, you're more likely to get heart disease, liver disease, kidney disease. And so is it really each of these individual diagnoses that's carrying the risk, or is it just a side effect of being older? So every state department of health is collecting this data and posting it on its website in various forms. For the Minnesota Department of Health, one thing that they've been doing since the beginning of the pandemic is that they've been looking at deaths by age. And as they got more and more data, they actually broke it up by 5-year segments. This is one of only a handful of states to do this at this point in time. By graphing this data, we can come up with some pretty impressive trends. Here's a table I just made on Google Drive. So this is Minnesota-specific data, and this table is looking at both the percent of cases by age and also the percent of deaths by age. So the blue line is representing the percent of the number of cases in each 5-year age group. And then the red line is looking at the percentile of deaths. So all of these numbers together are going to equal 100, both the blue and the red. And where we see the bulk of the deaths is really in those who are 65 and older. So then you can also just look at case fatality by age, right? Because all we need is exactly what the Minnesota Department of Health gives us. The number of cases within each age group and the number of deaths within each age group. And this is a very striking graph. and showing you how important age is into surviving COVID-19. And as a father of 3, I am relieved to say that COVID-19 just doesn't hurt kids the same way it hurts adults. There has been one death in Minnesota of a child who was under 4 that was attributed to COVID-19, but that has been the only death in anyone under the age of 19 in the state. I know that I'm a data nerd, and most people aren't. They're exceedingly bored with this. And so one way I've found that can kind of hit home is, all right, well, within a specific age group, how many people need to be infected for one death in that age group? So in the first table, we're looking at groups that take at least 1,000 infections to cause one death. And in the 20 to 24 age group, we need over 15,000 infections for one person to die. In the 25 to 29, we need over 6,000 infections for one person to die. 30 to 34, almost 3,500 infections. 35 to 39, my age group, 1,250 infections. In the 40 to 44, 588 infections to cause one death. 45 to 49, 555 infections to cause one death. 50 to 54, 322 infections to cause one death. 55 to 59, 217 infections to cause one death. Now we're moving on to the double digits to cause one death. 60 to 64, 97 infections, one death. We've crossed the threshold of the 1% case fatality rate. If you are over 60, your chances of dying of COVID-19 are greater than 1%. 65 to 69, 47 people for one death. 70 to 74, 22 infections for one death. 75 to 79, 1 in 14 is going to die. And this is all really scary, but it just gets worse. So when we're looking at those who are over 80, we're more than 10% chance of dying. So if you're in your 80s, somewhere between 5 and 8 people to be infected for one person to die. And for those who are 90, 1 in 4, and over 95, 1 in 3. In my own personal experience, I've seen several outbreaks at nursing facilities, and just the significant numbers of people that die as a result of that is just incredibly sad. I understand why when people hear different things over the course of a year, there's a level of mistrust. We value in our society consistency. The problem is science is always changing. If we had had this data on day 1, well, then we would have the data on day 1. But life just doesn't work like that. Scientific method doesn't lend itself to that. And we didn't know how this was going to play out. And we were really crippled at the beginning of this pandemic from figuring that out because we just couldn't test people. So the only way we're going to get to the other side of this pandemic is by preventing infections. And the only way we're going to accomplish that is through vaccinations and public health measures. That's it. So far, there have been over 23 million vaccine doses given in the United States, and just over 25 million people have caught COVID-19. So we're nearing the date where more people will have received the vaccine than caught COVID, which is so great. All right, so I know this is a heavy subject, but nothing infuriates me more than seeing on a Facebook post or Twitter someone saying this is just a bad flu. So that's a little bit about case fatality rates and why it's changed over the past year. I expect that the case fatality rates will largely stay in that 1.5% area. Unless some miracle pill comes out which really reduces the number of deaths, I don't think is particularly likely. The only way we're going to get through this pandemic is by getting vaccinated. That's it. So in summary, case fatality rates give us a sense of how lethal this infection is. Age is really the most prominent risk factor for dying from COVID-19. And there's a good reason why the case fatality rate has been dropping over the last year. And while some might argue it's because of improved treatments or doctors are better at it, I think that's total bunk. And the real reason is that we've just been testing and finding those asymptomatic carriers. Early on in the pandemic, we were very limited in the number of tests we had available to us, and we're only testing and catching those who were already very ill. To everyone out there who's lost someone from COVID-19, I am really sorry. This is a really hard subject to talk about, but it's a vitally important one to understand how important it is that we all do our part and get vaccinated when able. Thanks for joining me, and I'll see you next time.